And every day, Arizona's coronavirus case count just continues to go up and up. We know to our north, the Navajo Nation has been hit especially hard, and now our southern counties have also turned into coronavirus hotspots. Our Allison Rodriguez traveled down to Yuma and Santa Cruz County to see what may be causing that. It's part of our special series, COVID-19 on the Border.
In Arizona, most people know Yuma as the place to fill up on gas on the way to San Diego. It's the 5th most populated county in the state and quickly becoming a hotbed of coronavirus cases.
I think that we're really high right now. I also see that we get huge swings after any kind of event.
Serena Kugel owns a store along Main Street in the city of Yuma.
I do think that, yes, we are a little bit of a hot spot right now. Where are those numbers coming from? I don't know.
Medical experts say those numbers are a result of many different factors that affect Yuma and Santa Cruz counties.
The first thing that people have to understand is poverty is a public health issue. And we know that the higher the poverty rate, the more that patients are susceptible to a lot of the chronic diseases that plague the communities.
Santa Cruz County has a 24.4% poverty rate. The statewide average is 14%. The poverty rate in Yuma County is at 19.5%. And we have seen zip codes in both counties at the top of the list for cases on the Arizona Department of Health Services website.
Those social determinants of health, when combined with socioeconomic status and poverty, it creates the problem of patients not having access, not having the sometimes literacy rates in order to get good medical care.
Equality Health Medical Director Dr. Edmund Baker used to work down in Santa Cruz County at Mariposa Community Health Center.
Down in Nogales, there's another issue. There's not as many doctors available per the amount of people that are down there. So therefore, they have a desert because of lack of access due to not having enough physicians, and also financial reasons and transportation reasons because it's so spread out.
This is the only hospital in Nogales. It only has 25 beds, and it's not equipped to handle more severe cases of coronavirus. So patients have to be taken to Pima County for medical care, about an hour away. Rural communities dealing with healthcare deserts in a time when they need care most.
Last week ran at 140% of our normal capacity, and that's almost exclusively due to people wanting appointments to manage COVID symptoms or potential exposure.
Mariposa COO Daniel Prevo says they've had to open positions to try and keep up with the volume of patients due to coronavirus in Santa Cruz County.
We just don't have enough appointment slots to see all the patients who want to be seen. And it puts a huge, burden not just on the providers, but also the nursing staff and the support staff.
Medical researchers and county officials also believe cross-border traffic could be contributing to the spread.
Workers that cross from our side to work over in Nogales, Sonora, as well as workers from Nogales, Sonora coming here to work in the produce warehouses and other industries. So trying to keep a track of those workers is our hardest challenges. So that we work with the Arizona Department of Health Services Border Health to try to keep track of those workers as well.
Mexico is Arizona's top trading partner, accounting for about 30% of the state's exports to foreign markets. That's according to a study by the University of Arizona. This port of entry here in Nogales is the busiest in all of Arizona, particularly for commercial use. Truck drivers deemed essential during the lockdown, meaning traffic never really stopped here. And cases in Mexico are growing rapidly too. In the border state of Sonora, there are nearly 5,000 cases of COVID-19. But exact numbers are hard to tell after the New York Times found the Mexican government wasn't reporting hundreds, possibly thousands of coronavirus deaths in Mexico City. Meantime, transportation is one of the top industries in Nogales, along with food service and prep. In Yuma County, it's farming and agriculture, all industries that can make social distancing a challenge.
In the communities that are underserved, you find that we're in areas that are high touch. Those that are transportation workers, those that work on farms, those that are in fast food industry. These are high touch areas. We're always around people.
Walking through the Morley Avenue shopping area, many stores are closed due to the recent outbreak, and the few that are open are requiring masks, leaving residents with limited options and having to travel elsewhere if they want to shop.
You understand that we have a lot of the people down here do travel to those areas to do their shopping, for school, clothes for their kids and so forth. So they do travel throughout the state. So it is a concern throughout the state. Whether they come down here from, like, say, Tucson or Phoenix, come down to Nogales even, there is a concern that there is a lot of travel.
All these factors pose unique challenges as we deal with an unprecedented health crisis, and a second wave may be coming. So what can be done to try and slow the spread? How do county and city leaders navigate personal freedoms and public safety measures? We'll explore that tomorrow as we wrap up our look at COVID on the border. Reporting for ABC 15 Arizona, I'm Allison Rodriguez.